types currently heard in the Immigration Tribunal, all of which I hope will benefit her constituents.
Alison Bennett.
Thank you, Mr Speaker. My Mid-Sussex constituent has waited 4 months for a transcript that will prove the financial terms agreed with her ex-husband in family court, which he now disputes. Without it, she faces the expense of a barrister to go back to court in April. She is facing financial hardship as a result. What steps is the Minister taking to address severe delays in accessing family court transcripts?
Well, I'm sorry to hear about that particular case. Those sorts of delays mount trauma on trauma for many of those going through sensitive family court proceedings. Look, we've got to get this right. Because of the sensitive nature of family proceedings, there has to be judge approval, and it has to meet the rigorous requirements of the Secure Transcript Unit. We can't compromise on accuracy and quality, but we do need to get those delays down.
Brian Isham.
Thank you very much, Mr Speaker. Prison officers are beyond frustrated. They want the government to sit down with their union, the POA, to negotiate a fair and realistic pension age. Now, we were told in this chamber over a year ago that ministers were waiting for advice from civil servants. So, what does this advice recommend? And does it recognise that for prison officers, 68 is too late?
Yeah. Well, can I say to my honourable friend that I did sit down with the POA just a few weeks ago to discuss this and other matters. And of course, it's right that I prioritise investment in our prisons as I seek to support prison officers who do an incredible job against the backdrop of a system that was horrendously underfunded for 14 years.
Mr Speaker, my Hazelgrove constituent Simon came to see me with some concerns that he had following his and his family's journey through the family court and family involvement in arrangement proceedings. He raised a stat that stayed with me from Both Parents Matter, showing that 40% of separated fathers are experiencing suicidal thoughts. What more can the government do to support parents and everybody going through family court proceedings?
So sorry to hear of the experience that Simon has endured, and sadly so many others like him, fathers particularly, going through family courts. That is why today the Deputy Prime Minister has announced a national rollout of a child-focused model, formerly known as Pathfinder, for the next 3 years. This provides early risk assessments, specialist domestic abuse support for all involved, a non-adversarial problem-solving process. It reduces stress and anxiety for all of the families, better supporting their mental health. Hopefully this will not come as comfort to Simon, but it will help many other fathers and families going through this process.
Mr Speaker, only a couple of weeks ago I introduced my 10-minute rule bill on a requirement for the police to declare their membership of some societies or organisations such as the Freemasons. Now, what reassurances can the Secretary of State give this House that with the huge and controversial reduction in jury trials, that judges will not be unduly influenced by their membership of such organisations?
I'm grateful to my honourable friend. This is a sensitive matter. She will recognise that our judiciary are independent, but I continue dialogue with the Lady Chief Justice on these and other matters.
Thank you, Mr Speaker. My constituent, Lucinda Ritchie, is a disabled woman with full mental capacity. Until recently, she was living in her own home in Horsham with NHS support. Against her express wishes, she has been moved into a nursing home an hour away from her family and denied the right to return. I asked the Minister to look into Lucinda's case in particular, but also to work with your counterparts in the Departments for Work and Pensions and Health and Social Care to ensure that people's basic human rights are protected when it comes to medical decision-making.
I'm very grateful to the Honourable Member for raising this important issue. Of course, the practicalities of the case are for colleagues at Health, but he's absolutely right that human rights within a health setting are incredibly important. There are specific tribunals that deal with that issue. I'm very happy if he writes to me to deal with that case in writing.
Lord Allen.
Mr Speaker, unlike Category A prisons, prison officers at HMP The Verne and HMP Portland are not routinely issued with protective body armour, namely stab vests. Now, protecting our prison officers from harm is absolutely essential in all prisons, and this view has been made abundantly clear to me by local branches of the Prison Officers Association. So with all this in mind, will the Minister work constructively with me and Lord Timpson to introduce appropriate body armour for all prison officers, regardless of the category of the prison in which they serve?
My honourable friend's absolutely right to raise this issue. It's why the government has invested £50 million in ensuring that our brilliant prison officers who do incredible work are fully protected. I believe I'm meeting my honourable friend tomorrow to talk about another issue in his constituency, and we'll put this one on the agenda as well.
Thank you, Mr. Speaker. Have told us that they were trafficked between England and Scotland. The police were aware of these allegations of abuse but failed to do anything about it. So can the Minister explain how the grooming gangs inquiries on either side of the border will work together to ensure that perpetrators and those responsible for the cover-up are held to account?
What can I say to the honourable gentleman that the sexual exploitation and rape of children by grooming gangs is one of the darkest moments in this country's recent history. We accepted all of Baroness Casey's recommendations. We're changing the criminal law to ensure that adults who penetrate children under 16 are charged with rape or equally serious offences for other penetrative sexual activity. I'd want to assure him of that.
Ministers will be aware of the campaign to make all court and tribunal transcripts available for free. Fees can run into the thousands and act as an effective paywall to justice. So does the Minister agree that access to the law cannot be based on wealth alone, and what are they going to do about it?
Well, he is right that we are seeking to increase transparency and reduce barriers to access to justice. It's why we are legislating to make sentencing remarks available to all victims upon request for free. We want to see how we can go further, creating more opportunities for broadcasting court proceedings and working towards greater availability of transcripts of proceedings as well.
Miller.
Thank you, Mr. Speaker. One of my constituents has been waiting since September for a 3-day fact-finding hearing in the family courts. A hearing scheduled for February was cancelled with only a few days' notice because no judge was available. My constituent had to pay nearly £2,000 in legal fees for preparation and representation, even after their barrister reduced their costs. So will the Minister reform the system so that families facing delays caused by the courts are not left bearing the financial cost of failures within the system itself?
The impact of delays, as he rightly points out, is not just a feature of our criminal courts, but our civil and family courts as well. And the individual impact on that, both financially, and if you've been waiting, building up to the nerve-wracking prospect of a trial in court, it can be absolutely devastating. We are working to maximise capacity in every jurisdiction, hiring more judges to improve the timeliness, but I will continue to work with colleagues right across the department to deal with the delays in the family court as well.
Mr. Speaker, I refer to my register of interest, having met with the academics behind the UCU's reports into the prison education service, and particularly highlighting the real challenges around the well-being of educators, as well as their mental health and also their safety, and especially the racism they've been experiencing as well. Will my honourable friend look at how he could carry out a complete review of that prison education service to ensure it's fit for purpose and able to do the job it was designed for?
My honourable friend raises a really important point, and myself and Lord Timpson in the other place are looking at this particular issue in the round, as well as ensuring that we, where there are education contracts in prisons, that they are being given full effect, which actually often isn't the case. But my honourable friend raises a good point, and we are working on it, and we'll keep her informed.
Carl Lockhart.
Whilst it would be inappropriate to speak of a live case, I'm mindful of the McNally family who are currently, from my constituency, who are currently sitting through a trial of a man accused of murdering their daughter. Truly heartbreaking. There was another murder in County Fermanagh recently. This demonstrates again how unsafe society is for women, particularly with social media and online abuse. Can the Minister outline what efforts she is making with online platforms to do more?
I thank the Honourable Lady for raising this horrific case and for bringing this attention to the House. She is right to draw attention to the impact that social media and online abuse is having on the impact of violence against women and girls. It's why we are working across jurisdiction to try and tackle some of these crimes. We're bringing in the strongest protections against non-consensual intimate imagery, working with the Online Safety Act and our regulator Ofcom to hold social media accounts accountable. The Secretary of State for the Department for Science, Innovation and Technology recently held a roundtable with the platforms to discuss what more we can do to tackle this heinous abuse, but this government has been clear. Where the platforms refuse to act, the government will.
Thank you, Mr. Speaker. There's a lot of debate on the role of juries at the moment, I've noticed. If nothing gets past me, it might be better informed debate if the researchers and jurors could talk about what happens in the jury room Law Commission recommends decriminalising that. It's currently a criminal offence. So will the government do that in the Courts and Tribunals Bill?
Well, I'm very grateful to my honourable friend for the question. I think he makes a good point, and it is something that I will be reflecting on in the coming days.
Stevenson.
Thank you, Mr. Speaker. Can I first thank ministers for inviting me to a meeting yesterday on unduly lenient sentences? My constituent Tracy Hanson and other campaigners like her continue to raise powerful points on the need for victims to have parity of rights and support with offenders. Would the minister give the House assurance that the government intends to achieve that parity during this Parliament?
Well, I thank him for his question and also his attendance yesterday at the meeting. Tracy, his constituents' testimony, as well as other victims there, was truly powerful. As I said at the meeting in private, happy to say again at Dispatch Box, we are working at pace to look at this and look at all the solutions, and we'll be contacting his constituent and indeed him as and when we have our position.
Thank you, Mr. Speaker. Given the massive backlog in immigration tribunals left by the last government, wouldn't it make more sense to lift the cap on non-salary tribunal judges who are already recruited and invest in court venues like Taunton instead of abolishing their role and the massive damage to morale that involves?
Well, plainly, we have to address the backlogs in our immigration and asylum chamber. It's why we're maximising capacity, both in terms of sitting days and in terms of judicial recruitment. I had the pleasure of visiting the IAC in Rosebery Avenue recently and saw the commendable work that's being done by the resident judge there. But we are focusing on a new appeals body, working with the Home Office. We think that's the better plan, and we'll make sure that that's properly resourced as well.
Jim Allister.
Last week, Flora Page, KC, resigned as a board member of the Legal Services Board. In her letter to the Lord Chancellor, she said she couldn't stand idly by while he halved the number of jury trials and ripped the heart out of our Constitution. She also rebutted the suggestion that backlogs are because of jury trials, saying that was being used as a cover. Faced with such a devastating critique, isn't it time the department thought again?
Well, I'm sorry that she felt she was no longer able to serve. But I would say this, we took very seriously Sir Brian's recommendation that we would need to make more investment, and we are. That we would need to modernise, and we are. And that reform was essential. And that's why we put out the modelling, if we were serious about bringing down the backlog to levels that are acceptable, I think, to the population at large.
Right, that completes questions. We'll let the front bench change over. Right, we now come to the statement. Secretary Wes Streeting.
Thank you. With your permission, Mr. Speaker, I'd like to make a statement on the outbreak of meningococcal disease in Canterbury and East Kent. My thoughts, and I'm sure the thoughts of the entire House, will be with the families and friends of those two young people who've sadly died. I cannot begin to understand what they must be going through. This is an unprecedented outbreak. It is also a rapidly developing situation. With these considerations in mind, Mr. Speaker, it is absolutely paramount that we stick to the facts, which is what I intend to do. This is the current situation. As of 9:30 this morning, UKHSA has confirmed 4 cases of Group B meningococcal disease, with another 11 cases under investigation. The 2 deaths are associated with this cluster. The majority of cases link back to the Club Chemistry nightclub over the dates of the 5th, 6th and 7th of March and their associated networks. Club Chemistry is currently closed voluntarily. Going forward, Mr. Speaker, these figures will be updated publicly by UKHSA each day at 9:30 a.m. Let me now turn to the timeline of this outbreak. UKHSA was notified about the first case on Friday the 13th of March. In line with established protocol, health officials began identifying and tracing the patient's immediate close contacts who were offered prophylactic antibiotics as a matter of urgency. On Saturday, UKHSA were in touch with the University of Kent to ensure they had the necessary support, advice and guidance, and to establish where the patient was living. Also on Saturday, the French authorities alerted UKHSA to a second confirmed case in France from an individual who had attended the University of Kent. Both cases lived in private accommodation, and at that stage, there was no apparent link between the two. At 7 p.m. on Saturday evening, hospitals reported that a number of severely unwell young adults were presenting with symptoms consistent with meningococcal disease. Contact tracing of these individuals began immediately and continued into Sunday morning, March the 15th. All those traced were offered precautionary antibiotics. So far, 700 doses have been administered. Recognising the scale of the potential outbreak, at 10 a.m. on Sunday, UKHSA stood up a full-scale response, including preparations for more widespread distribution of antibiotics on campus. By 5 p.m. on Sunday, those antibiotics were in place and distribution began to students in the 2 halls of residence where we were aware of cases, and by 6 p.m. a public health alert was issued. Mr. Speaker, it is important that the House and the wider public understands that even before the public health alert was issued, students and young people who had been in close contact with suspected cases were being offered antibiotics. This is precisely what one would expect as a rapid response, and I'm confident UKHSA acted as quickly and as comprehensively as possible. In addition to cases involving students at the University of Kent, there were 2 cases identified involving sixth formers in Year 13, one of whom has sadly died. UKHSA made contact with the head teachers at both schools first thing on Monday morning and have worked closely with schools to provide information, advice and support, including a letter to parents that was issued that same day. We are working closely with DFE on wider communications to schools across the Kent area, and a briefing with schools has taken place this morning. Mr. Speaker, the strain associated with this outbreak is meningitis B, known as MenB. It is uncommon, as we have seen, a serious and potentially lethal strain of meningococcal disease. The onset of illness is often sudden, and early diagnosis and treatment with antibiotics are vital. It doesn't spread very easily. The bacteria is passed to others after a long period of close contact. For example, with living with someone in shared accommodation, through prolonged kissing, or sharing vapes and drinks. However, the symptoms are also easily mistaken for other common conditions, even for something like a hangover. And so, Mr. Speaker, let me now set out the current advice from UKHSA. Anyone who attended Club Chemistry on March the 5th, 6th or 7th, and anyone who believes they were in close contact with someone who's confirmed or suspected to have meningitis should attend a treatment centre and receive antibiotics. There are 4 centres open in Canterbury today, with 11,000 doses available on site. Details about the location of these centres are available on the UKHSA website and are being promoted by the UKHSA, the NHS, my department, schools and the university, as well as the BBC, and I encourage all media outlets to do the same. There is no need to book an appointment. A single course of antibiotics is highly effective in preventing the contraction and spread of this disease in 90% of cases. If you become worried about yourself, your child or a friend, particularly if symptoms are getting worse, please seek medical help urgently. Anyone with symptoms should call NHS 111 or in an emergency dial 999 to seek medical attention. Mr. Speaker, people are understandably asking about a vaccine. From 2015, the MenB vaccine has been available on the NHS as part of routine childhood immunisations, but clearly most students would not be vaccinated. Given the severity of the situation, I can confirm to the House that we will begin a targeted vaccination programme for students living in halls of residence at the University of Kent in Canterbury, which will begin in the coming days. UKHSA will provide further advice on other cohorts in the coming days. On the question of wider eligibility, we obviously follow the expert independent advice of the JCVI. In light of this latest outbreak, I will be asking them to re-examine eligibility for meningitis vaccines. I will do so without prejudicing their decision because we have to follow the clinical advice on this. Mr. Speaker, I will keep the House updated as the situation unfolds, and I commend this statement to the House.
Secretary of State Stuart Andrew.
Thank you, Mr. Speaker, and I'm grateful to the Secretary of State for advance sight of his statement and for the clarity he has provided to the House this afternoon. Our thoughts, too, are with the families of the two young people who have so tragically lost their lives. I cannot imagine the pain they must be going through at this difficult time. This will also be an extremely distressing time for parents, students, staff and the wider community across the South East, especially as I understand 2 more cases have just been announced. Indeed, yesterday, friends of mine were very anxious about their own son who was in the vicinity over the weekend. I also want to pay tribute to the NHS staff, public health teams, school and university leaders and all those working at pace to respond. I welcome what the Secretary of State has set out on the daily publication of figures, the scale-up of antibiotic provision and the decision to introduce a targeted vaccination programme for students in halls of residence, alongside seeking further advice from JCVI. However, there remain a number of important questions. First, on the timeline, as there have been concerns raised out there. The Secretary of State has set out the sequence of events in detail. But can he be clear about the threshold used for wider public communication and whether that threshold is being reviewed in light of this outbreak? He also set out that head teachers were contacted on Monday morning. Can he clarify when those schools were first identified and whether there is a need to review how quickly educational settings are brought into the response, given that cases were identified several days beforehand? Secondly, on the nature of the outbreak, while many cases are linked to a single venue, can he confirm whether all cases are believed to be part of one cluster, or whether there remains a risk of multiple sources of infection? Thirdly, on escalation, given the involvement of both a university and schools, can the Secretary of State set out what criteria are being used to determine when more extensive interventions are required across educational settings? This situation will undoubtedly cause concern among families, particularly with the end of term approaching. Can he therefore set out what steps are being taken to manage the risk of onward spread as students return home? And what advice is being provided to families and local health services in other parts of the country? Can he also confirm that public health messaging is fully consistent across schools, GPs, local authorities and NHS services, so that families receive clear advice wherever they turn? And what steps are being taken to counter misinformation online where false claims may undermine confidence in public health advice? Can he also confirm that local laboratories, intensive care capacity and public health teams are fully resourced to manage any increase in cases and that supply chains for antibiotics and vaccines are resilient should further clusters emerge? Finally, while I welcome the targeted vaccination programme and the decision to seek further advice from JCVI, the Secretary of State has acknowledged that most students would not have been routinely vaccinated against meningitis B, and protection among older teenagers is clearly not as strong as it is in infancy. Does he accept that this creates a particular vulnerability among older teenagers and young adults? And will he ensure that any further advice on eligibility or wider catch-up measures is brought forward as quickly as possible? Mr. Speaker, this is a serious public health situation. It is right that the response, though, remains calm, evidence-led and focused on protecting patients and supporting those families affected.
Firstly, Mr. Speaker, can I thank the Shadow Secretary of State for his constructive response and support as we respond to this incident, and also welcome the way in which he has rightly brought scrutiny to the response. And I should say from the outset, Mr. Speaker, that obviously once we're through this, we will obviously look at the handling of the UKHSA's response at every point, because inevitably there are always things that we can learn and seek to do better. The balance that needed to be sought in terms of public communication, Mr. Speaker, was to make sure that people were informed in a timely way, but also to make sure of two things. Firstly, we didn't spread unnecessary anxiety and concern. And secondly, that having been made aware of the risk, that there was a channel through which people could receive support. So as I set out in the timeline, in response to individual cases, thorough contact tracing was undertaken, antibiotics were offered in those direct contacts in those cases, and then by 5 p.m. on Sunday, we had the antibiotics more widely available, and 6 p.m. public communication went out. The schools were identified during the course of Sunday. That wasn't a straightforward experience. And in the case of those schools, the two schools, Simon Langton Grammar School, Queen Elizabeth's Grammar School in Faversham, were both contacted first thing on Monday. We're also looking at Norton Natchball School in Ashford, where there may potentially be another case, and we are working closely with those schools. They were notified on Monday morning, and we've stood up wider school briefing. We will look carefully at whether we could have done more quickly to identify those schools and to make contact ahead of the Monday morning. The Shadow Secretary of State asks about the criteria for educational settings and the sort of wider availability of vaccination. We are looking at this actively with UKHSA, and we'll make announcements about further cohorts in the coming days. In terms of local NHS capacity, the NHS in the South East region are supporting UKHSA, who are the lead agency, in the response to the bacterial meningitis outbreak. Kent and Medway ICB have stood up and are currently operating a hub at the Kent University site to deliver prophylaxis to students, and a second site has been open too. We've obviously made sure that in responding to patients presenting at hospital, that appropriate support is in place for those hospitals. The Shadow Secretary of State also asks about supply of antibiotics and vaccination. We're confident that we have the right levels in place to respond, and obviously as we think about potentially widening cohorts, we'll make sure that supply is available in a timely and effective way.
Shabakar.
Thank you, Mr. Speaker, and I thank the Minister for his statement, and I particularly welcome his announcement that he's reviewing the ongoing use of the vaccine to a wider cohort. Given that the universities at Kent also have campuses in Medway, could he just inform me what work he's doing with the universities to ensure that the spread across other campuses is monitored on a regular basis, and that if there is any potential for this to spread further, that has been reviewed regularly? Thank you.
So State.
I'm grateful to my honourable friend for her question. This raises an important point, and the Shadow Secretary of State raised this as well in relation to public health information. There are exams taking place at University of Kent this week, but there may be many students who've returned home. Indeed, there will be some students at the University of Kent in Canterbury who commute in from the surrounding area. We have 4 sites available on the in and around campus. So we've got the Senate building at the University of Kent, the Gate Clinic, Kent and Canterbury Hospital on Ethelbert Road in Canterbury, Westgate Hall in Canterbury, and the Carey building, which is at the Thanet Hub in Broadstairs. So which is planned to be open from Tuesday, the 17th of March. So we've got those 4 sites available. We're also making sure that for students who've gone home who may wish to access antibiotics because of risk factors or concern about symptoms, that they're able to contact their GPs and receive support locally.
Alison Bennett, Liberal Democrat spokesperson.
Thank you, Mr Speaker, and I'd like to thank the Secretary of State for advance sight of the statement. As other honourable members have said, first and foremost, my thoughts are with those 2 young people who have lost their lives, their families and friends, and everyone who has been touched by this devastating outbreak. It is understandable that many young people and their families will be feeling anxious. With that in mind, is the Minister confident that this outbreak is contained and has not yet spread beyond those present at the initial event? It is not unreasonable for young people and their families elsewhere in the country to be wondering whether they should be seeking catch-up vaccines. Young people will not have been protected by the MenB vaccine available to those born after 2015. Is the Secretary of State confident that there is sufficient stock to deliver protection to all those who need it? And as well as talking to the JCVI, will the Secretary of State involve Meningitis Now, who have called for teenagers and young people born prior to 2015 to be vaccinated against meningitis B on the NHS? Mr Speaker, vaccinations rates are falling in the UK, including for meningitis. To this end, all politicians and all political parties have a moral duty to support science over conspiracy theories. It is deeply regrettable that certain parties have not been responsible in this respect in recent months. I and my Liberal Democrat colleagues are worried that these avoidable deaths will become more common should this narrative persist. We must encourage those communities and healthcare workers who are not currently taking up vaccines to do so. We must build trust, tackle disinformation and encourage people, regardless of where they live, to take up life-saving vaccines. Thank you.
Secretary of State.
Can I thank the Liberal Democrat spokesperson for her response and also strongly endorse what she said about the importance of vaccination. When it comes to determining which vaccines are available and to which cohorts, obviously we follow the advice of JCVI. But I really hope that if there's one good thing that can come out of an awful situation, it's the general public awareness of the importance of taking up vaccinations where they are available. They remain one of the best public health tools available to us, and it is on one hand a very good thing that there are few people alive in this country today who remember the dark days that where this country didn't have a national health service and didn't have vaccination available for common treatments. It's wonderful that we now live in a country where there are very distant memories of some of those everyday conditions being widespread killers. But there is also a real risk of a return to those Victorian conditions because of that misinformation, anti-science, irresponsible political positioning that we see in certain corners of even this House. So I really hope that politicians in particular will think carefully and responsibly about our shared duty to the public to help people be protected. In terms of the specific concerns raised, the public health risk to the wider population remains low, but we are actively contact tracing and offering antibiotic prophylaxis to those in close contact with cases. The antibiotics are really effective, and it's one course and is effective in 90% of cases. So we are actively contact tracing, but once again I emphasise, for people watching, if you or someone you know develops symptoms of meningitis or septicemia, seek medical help urgently by calling 111 or 999, particularly if symptoms deteriorate. And if you're one of those students at the University of Kent who may have left campus and would otherwise have been visiting one of those 4 sites, we're making arrangements for you to be able to see your GP and receive the antibiotics there.
So Sanchez.
Thank you, Mr. Speaker. I thank Honourable Secretary of State for the statement. I want to pay tribute to all the health leaders in Kent and the school leaders for their calm and quick actions yesterday and over the weekend. I was able to get a briefing from UKHSA yesterday morning, and also was able to visit my local hospital, William Harvey Hospital, where they have made immediate changes to A&E to care those patients who was turning up. There were many speculations were spread around on social media and local newspaper, especially around suggesting vape sharing may be the reason behind this. So can I ask the Health Secretary, while I'm not asking him to comment on the speculation, can he reinforce public health message, and can he offer advice to young people and parents in the Kent area on precaution they should be following at this time?
Secretary of State.
Can I thank my honourable friend for his support for the local health system and for engaging so actively with my department and the UKHSA team in response to this incident. He's absolutely right to press on the issue of public advice, and perhaps it's helpful for me to be clear. Transmission requires close and prolonged contact to spread. And this may be if you live in the same household as someone and there's intimate contact, such as kissing, sharing of vapes, drinks, those sorts of things, that's where the risk exists of spread. So this is not like some of the other respiratory conditions that we've seen more recently, and it is important people understand how this disease is spread, because I think people may find that reassuring. But also we've got, I think, a range of symptoms that can present. That can include a rash that does not fade when pressed with a glass, sudden onset of high fever, severe and worsening headache, stiff neck, vomiting and diarrhea, joint and muscle pain, dislike of bright lights, very cold hands and feet, seizures, confusion or delirium, and extreme sleepiness or difficulty waking. Now, there's, those symptoms could also apply to a wide range of other conditions. So, as ever, if in doubt, the best thing to do is to seek medical advice, whether that's calling 111, in an emergency, dialing 999, or indeed seeing your GP. But I urge everyone to share the public health information as it's disseminating online, so we can spread facts rather than misinformation.
Leila Moran, Chair of the Select Committee.
Mr. Speaker, I would like to share, of course, my condolences with those families and communities affected by this. I cannot begin, as the Secretary of State said, to imagine what they must be thinking and feeling during this time, and also to thank those staff who have been involved in the response. I echo Secretary of State's hope that from this tragedy will come greater public awareness, but may I also add to that an increased laser-like focus on vaccination and immunisation from the highest levels of government. He may be aware that the Select Committee did a one-off inquiry into vaccination and immunisation. I have to be honest with him, it is one of our strongest letters we have ever sent the department. We have deep concerns. We use words like complacent, which, by the way, I don't think apply to this specific case. I do believe that the UKHSA have taken this incredibly seriously, and the mobilisation has happened, but I have to say despite, not because of, underlying resilience in the current system. Will the Secretary of State undertake to look at what we have sent him and his department, and he undertake himself to want to lead this response, not just for this incident, but for the whole of vaccination trends in this country from now on?
Secretary of State.
Can I firstly welcome what the Chair of the Select Committee has said about the response to this particular incident, and she is right to press more broadly on the issue of vaccination. If I think back to the winter campaign we've just run, it was more successful than last winter, but directly to her point about complacency, I would be the first to say that even with that improvement, I still don't think we are doing well enough as a country when it comes to vaccination rates. I'm particularly concerned about childhood vaccine. I can give her the assurance that not only will I and our new public health Minister look very carefully, who I welcome to the chamber and the front bench, We will look at that very carefully and take that very seriously and reply both directly to the committee and in terms of actions with the seriousness that the letter warrants. But also just reassure her I'm already talking to my right honourable friend, the Secretary of State for Education, of what more we can do together as the Department for Education, the NHS, Department for Health and Social Care, to make sure that we are improving childhood immunisation as well as wider vaccine uptake across the population.
Thank you, Mr. Speaker. I'd just like to add my name to all the people who are sharing that their hearts are going out to everyone affected by this terrible tragedy that's unfolding. It's particularly to people in Sittingbourne and Sheppey, many of whom are students who attend the universities in Canterbury, who go to schools in Faversham, and of course lots of constituents who are staff there as well. It's going to be particularly hard on my constituent Sue, whose son died of meningitis a few years ago, and she's been tirelessly campaigning for a change in the law on duty of care for people in those situations. Matthew could be alive today if action was taken swiftly enough by the people who were with him. So I just asked the Secretary of State, what more can we do to make sure that everyone on the ground across Kent and more widely really knows what to do in case they see the signs and symptoms of meningitis?
So stay.
My honourable friend raises such an important point, and let me through him convey my thoughts and condolences to Matthew's family and via them to so many families across the country for whom the news headlines will be particularly painful because they have both lived through and are still living with that grief and loss as a result of this devastating disease and the loss that it can bring about. He's absolutely right that we need to make sure that there is wider public understanding of the signs and the symptoms, but also we're not complacent about that within the health system itself as well, where sometimes in busy A&E departments, in busy GP practices or in pharmacies, things can get missed, and it's really important that we pick those concerns up and act quickly. I know that there are views on vaccination and the need for more widespread vaccination. Of course, I've asked JCVI to look at that, but we'll follow the scientific evidence.
Helen Wakely.
Thank you, Mr. Speaker. And can I thank the Secretary of State for his statement and his communications with me. Juliet was a schoolgirl in year 13 at Queen Elizabeth Grammar School in my constituency. She died of meningitis this weekend. Her head teacher said of her, she was incredibly kind, thoughtful and intelligent, and treasured. I'm also a parent of a year 13 student, and my heart goes out to Juliet's family and the family of the university student who has died. Sixth formers and students mix in the same crowded venues in Canterbury, so the government must fully consider the risk to school kids as well as the students in the universities. I'm grateful to the NHS and the UKHSA for the action they have already been taken locally, but many parents feel that they're not getting enough information, and schools have also found themselves struggling to get guidance. Can I ask the Secretary of State, why was there no contact with schools until the Monday? Have all school pupils who went to Club Chem been identified and invited for treatment? And will he roll out the vaccination programme he's spoken about to local schools, including residential schools in the area?
Secretary of State.
Can I thank the Right Honourable Member firstly for that wonderful and moving tribute to Juliet from her head teacher, which I think just brings into sharp relief the devastating impact that this has had and the anxiety that many other parents will be feeling in common with her. Can I also thank the proactive way in which she has been in contact with me and with UKHSA over the weekend. She's asking the right questions. My understanding, we will obviously review this and come back in more detail to the Right Honourable Member, but also the House. There was some challenge on Sunday identifying the schools concerned, and contact was made on Monday morning. I think we do have to look really hard at whether more could and should have been done to have been in touch with those individual schools on the Sunday, but I think schools more generally, she's absolutely right to identify that there will have been other sixth formers over the age of 18 and potentially some who maybe should not have been in the nightclub but may have been. And it's really important that we have a grip on who those young people are to make sure they get access to good, high quality health information advice and to make sure they know where to go where they have concerns. I am confident that these 4 hubs will reach those young people and that the flow of information is improving, but she is absolutely right to press and probe on whether we could and should have been more effective at communication with schools, as we certainly were with the university.
Jim Dixon.
Thank you, Mr. Speaker, and can I thank the Secretary of State for his statement, and I absolutely echo his words and those of other members on the tragic loss of 2 young lives to meningitis as a result of this outbreak. Many residents in Dartford remain understandably concerned, and can I welcome therefore his assurance and those of UKHSA that the meningitis outbreak is linked to a very specific venue and event. And obviously it's been encouraging to see the swift action from health authorities as well as local public health teams to trace those who attended club chemistry and offer preventive antibiotics to tackle the outbreak. Would the Secretary of State be able to confirm for my constituents that those who attended the club should go immediately to designated sites for antibiotics and that anyone else experiencing symptoms should contact their GP or dial 111 as soon as they can?
Secretary of State.
Can I thank my honourable friend for his questions, and he is absolutely right, and actually I didn't respond to this question from the Shadow Secretary of State, so let me do so now, since the questions are linked. All cases are presently being treated as linked to the the nightclub, that's one, incident and cluster, but we're not taking that for granted. And so we remain open-minded and continually assess that as information comes in from patients and their families, which can take time because they're often very sick. We via UKHSA are making available the opening times and locations of the 4 hubs. If people are concerned they've been in close contact and are worried about the risks themselves, they can come forward for antibiotics, which will be made available to them.
Rosie Duffy.
Thank you, Mr. Speaker. Firstly, I'd like to thank the Secretary of State personally and his team for their engagement on this awful situation in Canterbury. As you can imagine, all in my constituency have been devastated by the tragic death of Juliet Kenny and another student from the school disease, and I thank my neighbour for her lovely tribute to my constituent. We've been inundated by questions from extremely worried constituents, and he's answered some of them in his statement. The main one being around the rollout of the vaccine, and I was really pleased to hear that that's going to happen soon. Worried parents and vulnerable students are telling me that communications from their education settings are not consistently clear, however, with one school having closed to Year 13s. What's his message about attendance in person? And lastly, there are reports from medics on the front line at the moment in the hubs that the service has been absolutely overwhelmed with requests for antibiotics and people just presenting with mild colds and coughs. So could you make very clear once again exactly why and when they should turn up? And I think the time for addressing the concerns about the rollout of information isn't now, but hopefully we can drill down on that after this horrible event. Thank you.
Secretary of State.
Can I first of all thank the honourable member for, again, her proactive approach over the weekend and in recent days, given the impact this is having on her constituency and the devastating impact on her constituents. Just to reassure her about 2 things. Firstly, we are not advising school closures, and I think it's important that we once again just underscore the nature of the transmission of this disease, which is close personal contact, kissing, sharing vapes, which I am concerned about in the context of young people, sharing drinks, and obviously if people live in a household together, some of those things are even more likely to occur. But the general risk is low. So I want people to think carefully about their own situation, but people shouldn't be unnecessarily worried or anxious. In terms of where we are on antibiotic access, students at schools who've had close contact, those who are at club chemistry, they can attend the sites for antibiotics. This was the message that went out to all Kent schools this morning, so hopefully there will be an improvement in the flow and accuracy of information going to schools. My honourable friend is absolutely right to say we need to, once this incident has passed, to look back and reflect on what was done when and what can we learn from that. But at the same time, I'm also keen to make sure that we're listening, getting active feedback from members across the House and improving in real time as well. So we will keep these channels open, not just through the questions today, but through briefings with members of Parliament, keeping our channels open so that we can get feedback from locally elected representatives, which in her case and others has been extremely valuable.
Lawrence Sullivan.
I'd like to send my condolences to the families affected and for all those that have lost young lives in the past of meningitis. I welcome the Secretary of State on the targeted vaccine programme as well as the rollout to deliver antibiotics at pace. Vaccines are the most effective way and powerful way to protect individuals and community at large. But we know that infectious diseases mutate and we must be ready. So will he commit to the work being done in the future to look at MenB vaccine to make sure that it does offer wider protection, and similar to the MMR vaccine which is offered to students and young people before they embark on life, would this being considered to be part of that package?
Can I thank my honourable friend for her question? We can be proud as the UK that this was the first country in the world to roll out the MenB vaccine, and in terms of who might be eligible in the future and on what basis, we always rely on the advice from JCVI, which is independent and based on the data and scientific research. Because of the nature of this outbreak and the speed at which we've seen disease spread, I am asking them to look again at the advice they've provided without prejudice to any decision they might take. I just think it's prudent, given our most recent experience and what we've seen in recent days, that JCVI take those factors into consideration and issue fresh advice to the government.
Tom Tugendhat.
Thank you, Madam Deputy Speaker. May I start by just thanking the Secretary of State and the medical teams who have responded incredibly quickly, particularly to UKHSA, who've done a phenomenal job in tracing and making sure that we have preparations in place. There are, of course, lessons to be learned, but we'll park that for a moment. May I just ask about the antibiotics, because there were people who were not only in East Kent but actually in Tunbridge who were at Club Chem over those days. And for very understandable reasons, they don't particularly want to go all the way back to Canterbury. Many of them are feeling rather nervous about it. Is there a reason why the antibiotics are not available in Tunbridge, as has been told to me by one of the medical groups in the town? Or is there a possibility that these antibiotics will be spread so that people can receive them in other locations?
Secretary of State.
I will, following the right honourable member's question, ask about whether expansion to Tunbridge would be a sensible thing to do, given numbers that may or may not have been in club chemistry on the dates affected. But I'll take his point about some people not being willing or able to travel to the 4 sites that have been made available in Broadstairs and Canterbury. Nonetheless, we are, not least because of the students who've left university for the Easter break, we are, through the NHS, making sure that GPs are able to prescribe antibiotics. I know he's talking about different cases, these won't be students, but we'll make sure that people can get access to antibiotics via their GP. If that hasn't fully answered his question, he's shaking his head, I'll catch him afterwards to make sure I do.
Daniel Francis.
Thank you, Madam Deputy Speaker, and can I share my condolences to the friends and family of those two young people who've so very sadly lost their lives. 9 years ago, I saw my own daughter have a 42-minute seizure, and thanks to the work of the NHS and the drugs, she recovered from meningitis B, so I know exactly how terrifying that situation can be. But for lots of families around the country, they will have their children currently at university and be hundreds of miles away. So what assurances and advice can the Secretary of State give to those families about the conversations they should be having with their young people in Canterbury about the health advice they should be seeking and the symptoms they should be looking for?
Secretary of State.
Can I thank my honourable friend for sharing his own awful experience and for once again emphasising the importance of good public health information and advice, including for those parents whose students will still be in Canterbury and therefore may be particularly worried. So UKHSA is now advising anyone who visited Club Chemistry on the 5th, 6th or 7th of March to come forward for preventative antibiotic treatment as a precautionary measure, which can be collected from one of 4 sites. If they or someone they know develops symptoms of meningitis or septicemia, they should seek medical help urgently by going to the nearest accident emergency department or dialling 999. If it's not an emergency and people are concerned, they can contact their GP or NHS 111. Symptoms of meningitis and septicemia can include the rash that doesn't fade when pressed with a glass, sudden onset of high fever, severe and worsening headache, stiff neck, vomiting and diarrhoea, joint and muscle pain, dislike of bright lights, very cold hands and feet, seizures, confusions or delirium, and extreme sleepiness or difficulty waking. And I just want to underscore again, in terms of the risk of transmission, the general risk is low, and transmission takes place through close, direct and prolonged personal contact with things like kissing, sharing vapes and drinks. So that's why I think we need to get the balance right between awareness, and people thinking about their own situation and whether any of these factors apply to them, without spreading unnecessary anxiety, because most people, including the overwhelming majority of students at the university and people in Canterbury, will not be at risk.
Kirsty Blackman.
Our thoughts just now are with everyone involved in this, and particularly our support is with all of the staff that are dealing with it, whether that's medical professionals, university staff or UKHSA. And I understand that the Secretary of State's immediate priority will be in relation to this specific outbreak today. Dr. Amir Thallingham from UKHSA was on Radio 4 this morning and suggested that the progression of this outbreak is atypical. Would the Secretary of State give reassurance that the devolved authorities, health authorities, will be given updates on this so that they are aware in case there is another atypical progression at any point in the future anywhere else in these islands?
Good question.
Secretary of State.
Yes, can I thank the honourable member for her question. She's absolutely right about the atypical nature of this outbreak, and I can reassure her and the House that UKHSA is in regular contact with the devolved administrations.
Clive Efford.
Deputy Speaker, my heart goes out to the families that are bereaved in this terrible tragedy. The pain must be unimaginable, and I wish a swift recovery to those that are being treated in a hospital. And I also want to commend the UKHSA for its swift response, notwithstanding any lessons that need to be learned. Nonetheless, they do seem to have reacted very quickly and effectively. But how confident can we be that this is contained within the area as identified, and is there a contingency plan should there be any outbreaks in other areas? As a South East London MP, clearly I have concerned constituents.
Secretary of State.
Yes, I'm very grateful to my honourable friend for his question and mindful of the concern that neighbouring communities may feel across his part of London and the wider South East. I think just to reassure on 2 points. One is that the general risk is low because of the nature of the transmission of this disease, and also because of the active contact tracing that's underway, where I think UKHSA has done a particularly impressive job given the unusual nature of this outbreak. So I think we can be reasonably confident that we are tracing people, managing risk in that way. So even as students return home from university, we are managing the risk being in proactive contact with people, making antibiotics available, and also now actively considering what we might do in terms of, but not just the targeted vaccination campaign that we're preparing for the coming days, but also the wider cohorts that UKHSA may deem necessary.
Neil Shastry-Hurst.
Madam Deputy Speaker, and I know from my time in medicine that all those involved in combating this outbreak will be working at pace and they have our utmost respect. However, there will be concern around the report in The Independent in the last hour or so that certain pharmacies in the region are running out or running low on MenB vaccine. Can the Secretary of State commit to looking into that personally, and can he ensure that we get a robust supply chain?
Secretary of State.
Thank you, Madam Deputy Speaker. I can understand that there may well be some people who are choosing to buy the vaccine, but just to reassure on 2 points. One is that we do have a significant stockpile of vaccine, and secondly, we are taking an evidence-based approach to vaccination, starting with the targeted vaccination programme that UKHSA is preparing, thinking about additional cohorts, and we obviously always keep an eye on our medicine supply more generally.
Charles Atwell.
Thank you, Madam Deputy Speaker, and I thank my right honourable friend, the Secretary of State, for his statement. Parents of teenage and university-age children across the country will be looking on with increasing anxiety. What is the Secretary of State's advice to parents in other parts of the country, and in particular for parents in the Kent area? What exactly are the symptoms that they should be looking for?
Secretary of State.
I'm very grateful to my honourable friend for his question, and I know there will be lots of parents who are concerned about this. As I've said, I mean, the first thing is for individuals to think about their particular risk of exposure. We have already made available the 4 hubs for people to come forward and get antibiotics, and we will continue to actively contact Trace 2. In terms of those symptoms, as I've said previously, it's a range of symptoms: a rash that doesn't fade when pressed with glass, sudden onset of high fever, severe and worsening headache, stiff neck, vomiting and diarrhoea, joint and muscle pain, dislike of bright lights, very cold hands and feet, seizures, confusions or delirium, and extreme sleepiness or difficulty waking. Those symptoms can apply to a range of conditions, but I think it is a good thing if particularly students who may have been at club chemistry on the dates concerned, instead of writing off some of these symptoms as a hangover, it is better to be reassured than ignorant, and therefore going forward seeking medical attention and advice is the right thing to do, rather than simply writing it off as another one of those things. So I would urge parents to give that advice to young people and to students to follow that advice too.
Vicky Slade.
Thank you, Madam Deputy Speaker. Meningitis is one of the worst nightmares that parents worry about particularly when their teenagers leave home and are living away. My constituent Vicky Purdy from Corfmullen had her life changed 2 years ago from meningitis, is still unable to walk unaided, but is calling for meningitis awareness in schools, particularly via PSHE lessons and in university through freshers packs. Will he talk to his colleagues in DfE to progress this, given the high-risk nature of this age group and the fact that this age group will not have been vaccinated if they were born before 2015?
True State.
I think that's a really constructive suggestion. We will absolutely look at that. And in reply to the member for Tunbridge, who's just returned fleetingly to his place, it's an amazing skill he has. I think his question was about the availability of the antibiotics in Tunbridge, not necessarily a distribution centre. Just to reassure, there are sufficient antibiotic stocks at the university hospitals and the ambulance service, and we are working with local resilience partners to ensure effective distribution. I will pick up that point about Tunbridge, given proximity and likelihood that many residents will have been at the club in question.
James Asser.
Thank you, Madam Deputy Speaker, and I join our honourable members in sending my condolences to the families of the students who have died. As my right honourable friend will be aware, I was once upon a time the NUS officer responsible for national health campaigning, and a meningitis outbreak on campus was always one of our great anxieties. And we used to run awareness campaigns that we know from feedback at the time that allowed students to be aware of the symptoms to be able to get that urgent medical treatment. Whilst this is a localised outbreak, there will obviously be anxiety across the country from parents and students watching this. Could I ask the Secretary of State whether he would look at his department working with the National Meningitis Charities, the National Union of Students and local university authorities to run a national awareness campaign so that the symptoms he has been outlining today are fully understood and aware, so that students can understand what to do if they spot them?
State.
Well, like my honourable friend, I'm a member of the NUS Mafia in this place and well understand the enormous value that students' unions bring to promoting student welfare, raising awareness. I think he's absolutely right about meningitis risks and other infectious disease risks on university campuses. And I think he's absolutely right to suggest that we should work with the meningitis charities and others and NUS and students' unions to see what more we can do, not just in response to this outbreak in Kent, but more generally to raise awareness amongst a group of students who, by the nature of their studying and living conditions, can be more prone to the spread of infectious disease.
Edward Arger.
Thank you, Madam Deputy Speaker. And can I associate myself with the Secretary of State's remarks that the thoughts of all in this House will be with the families of those who tragically died and all those who've been affected. While understandably there are questions over vaccination and antibiotic eligibility, it's important decisions continue to be guided by clinical experts, and we do have some of the best in the world in this country. So I welcome him asking the JCVI to review eligibility criteria. Will he please be unequivocal, and I think he's alluded to this, that he will continue to be guided by that expert clinical advice in any decisions he subsequently makes?
Secretary of State.
I'm extremely grateful to the right honourable gentleman for raising that question and making this point. It sometimes feels that barely a month, if not a week, goes by in this job at the moment where I am regularly exhorted to make a political decision overriding clinical advice. I think that's the wrong thing to do, and I also think it sets a dangerous precedent, particularly when there are others in this House who might be minded to make ideological judgments about science and medicine, which are neither good science nor good medicine. So I think there is an important principle to defend here, which is where we're making clinical decisions, it should be based on good, high-quality clinical advice based on robust evidence and data. And I can give him that assurance that I will continue to follow clinical advice, and he's absolutely right to raise this particular point of principle.
Danny Beales.
Deputy Speaker, and I also welcome the Secretary of State's statement and share his sympathies and condolences with the families who've lost young people in recent days. Obviously, parents and students are very concerned at the moment. There's reports online that private pharmacies are selling vaccinations for several hundreds of pounds. Can the Secretary of State assure this House that the NHS England and Department for Health are monitoring any possible price gouging around vaccinations? There isn't profiteering on these tragic events. And just to echo the chair of the Select Committee's earlier comments, that Select Committee did look at vaccinations very recently, and whilst this isn't directly related to this incident, there has been a number of outbreaks across the country of different diseases recently. Some are associated with declining vaccination rates. So will the Secretary of State update us on his thoughts about whether the 2023 vaccination strategy from the last government does need a fresh look to deal with both uptake and also responses to outbreaks?
Secretary of State.
Firstly, can I thank my honourable friend for the excellent work he does as a member of the Select Committee and give him that reassurance that we are taking the committee's letter and advice very seriously. And I think he's right to ask us to look again at the 2023 strategy. Can I also just reassure him that to price gouge or profiteer in this situation would be a totally immoral and irresponsible thing to do. And then more generally, in terms of the advice we're giving to the public, we're not advising people to pay for a vaccine. If it is decided that any vaccination is required, that will be offered on the NHS. The MenB vaccine is already offered to infants, and the ACWY vaccine to adolescents and young adults free on the NHS. And that's the advice. I understand people may wish to make individual choices, but the advice stands, and I would urge people not to allow themselves to be ripped off by people trying to exploit understandable public anxiety.
Sir Julian Lewis.
I've heard a suggestion that this type of meningitis is more widespread in some countries than in others. Is there any truth in that? And if there is, would there be wisdom in suggesting to young people travelling to the countries concerned that they ought to add a vaccination as a prophylactic for this possibility?
Secretary of State.
Well, Madam Deputy Speaker, I'm not sure to the point of prevalence. I think we will look carefully at the genesis of this outbreak, and of course, in common with the point raised by my honourable friend, the member for West Ham and Beckton, we will think about what advice ought to be offered. And as ever, when it comes to travel advice, we rely on the evidence available, and we regularly, with our partners at the Foreign, Commonwealth and Development Office, and offer good travel advice to British citizens who are travelling abroad where there may be exposure to greater health risks.
Carla Lockhart.
Thank you, Madam Deputy Speaker. Given that we are facing the Easter holidays and students will be transiting home, what discussions has he had with the Minister of Health in Northern Ireland regarding students who will be travelling home, just so that they're aware of the situation and the need to take precautions?
State.
Just to reassure the honourable member that UKHSA is in close contact with all devolved administrations to make sure that they understand both the nature of this outbreak and what we're seeing and how we're responding, but also through contact tracing to also help devolved administrations to manage risk, and we'll continue to keep that regular contact.
Sir Gavin Williamson.
Thank you, Madam Deputy Speaker, and if I can thank the Secretary of State for his statement. Obviously, we're very rapidly approaching the time where university students will be dispersing, heading away from halls of residence and their campus right across the country. And I just wondered what actions the Secretary of State was taking to work with not just the universities but health authorities and bodies right around the country to make sure that any cases that may be dispersed around the country are quickly acted upon.
Secretary of State.
I thank the right honourable gentleman for his question, and I can reassure him that through partners at the NHS, we're making sure that antibiotics, for example, are available to GPs to prevent students from having to necessarily return to Canterbury, especially if they've travelled a long distance to return home. There is obviously a widespread public awareness of this outbreak. And therefore, in all of our NHS settings, there will be particular vigilance for these types of cases which are rapidly reported. I'm also reassured at the extent to which contact tracing with UKHSA is effective and people are responding accordingly.
Shawkat Adam.
Thank you, Madam Deputy Speaker. I'd like to thank the Secretary of State for his statement, and I too would like to express my condolences to the family and loved ones of the two young people that have passed away, and send my best wishes to those that are in hospital. As a father of a daughter at university, I can't imagine what they must be going through. Madam Deputy Speaker, many students have expressed to newspapers like The Guardian their concerns of actually returning home where they have vulnerable loved ones, citing a mother coming back from hospital or those that live with their grandparents. Is there any advice the Minister can give to students who are returning home to loved ones, if there's any advice for not spreading the disease to them?
Secretary of State.
I'm grateful to the honourable member for his question. It's worth bearing in mind that the transmission of this particular disease is through close and prolonged personal contact. And therefore, the risk of transmission is much lower than other outbreaks of disease we've seen in this country in recent years, particularly respiratory diseases and some of the concerns people have had around flu over the winter, for example. We are obviously actively contact tracing. We're making antibiotics available, and of course it is for individuals to make their own judgments about their own risk of exposure and therefore what that means in terms of close personal contact. But more generally, in terms of the situation of students returning home from university, if they're sat next to someone on a train, for example, then that's not close, prolonged personal contact. So I hope that reassures people that through contact tracing, through the availability of antibiotics, through the standing up of the targeted vaccination campaign, we are actively managing the risk of transmission, and the risk to the general public is very low.
Can I thank the Secretary of State for his statement this afternoon? I'll allow a few moments for the front benches to swap over.